evening, everyone. Thanks for joining us. I'm Brandon Lee.
And I'm Chris Pickle. Tonight, the number of Arizonans infected with coronavirus is going up. We now have more than 5,700 confirmed cases and nearly 250 deaths. So far, less than 1% of our population has been tested. That could soon change. The state is expanding the criteria to get tested. That means anyone who thinks they were exposed can get a test, even if they are not showing symptoms. Labs have the supplies to perform those additional tests, and until now, the tests were limited only to high-risk individuals and people with symptoms.
So one of the biggest dangers from this outbreak is our healthcare systems being overwhelmed, running out of room to treat people. Well, thankfully, it hasn't happened here, but tonight we just learned how close we actually came to that very deadly scenario. Our chief investigative reporter, Morgan Lowe, is here tonight with the inside story, Morgan, of how our state actually dodged that big bullet.
Yeah, Brandon, you probably don't remember. I don't remember what I was doing on April 8th. That day came and went without incident, but that was the day that Arizona hospitals were going to run out of ICU beds if they didn't take quick and decisive action to increase their capacity.
We must continue to increase our bed capacity.
That statement was almost an afterthought back on March 25th. The state had just closed all schools, declared a public health emergency. People were getting sick and employees were losing their jobs. But the following day, Governor Doug Ducey issued an executive order to increase hospital bed capacity by 50%. That day, there were 741 ICU beds in use throughout Arizona, with 1,199 available. This graph shows how the numbers of beds and patients rose, then stayed relatively stable until April 8th. That is when the state saw a surge in ICU patients. If the number of available beds had remained the same as it was on March 26th, we would have been overrun, overwhelmed, and over our ICU capacity. It was a rush behind the scenes by hospitals across Arizona to implement emergency surge capacity, and it worked.
Today we have 1,668 plus 485 additional beds available as needed.
That was Governor Ducey yesterday, a little less than 1 month after signing the executive order.
This is good news, and it shows we're prepared in Arizona.
The Arizona Department of Health Services just released this data yesterday, and we took it and plotted it on a timeline. So you can see the number of beds we've got in Arizona, the number of beds that were taken, the number of ICU beds, and the number of ventilators. And we put it on our website and our AZ Family app, so you can go on there and check to see for yourself just how close we came 2 weeks ago to being overrun by this virus. But because of that great planning, we were able to absorb that increase. Brandon, back to you.
You know what, Morgan, you're absolutely right. I do not remember at all what I was doing on April 8th, but let's go back to that surge that we saw on the 8th. Do we know how many of those ICU patients were actually infected with COVID-19?
So between April 8th and now, it has ranged from between 250 a day to about 305 a day. Doesn't sound like a huge number. It's somewhere between 12 and 20% of the total ICU patients on any of those days. But that increase is significant, and it did require these hospitals to really increase their capacity.
Really is solid reporting. That is our chief investigative reporter, Morgan Lowe, reporting tonight. Morgan, thanks.